Hello, welcome everyone. We're looking forward to a really important conversation. Quick agenda. I'll go over a few housekeeping items. Our panelists will introduce themselves. We'll spend the bulk of the conversation in live discussion, and then we'll have some time at the end for Q&A. You can see at the bottom of your screen, there's a Q&A tab. Please feel free to drop your questions in there, and we'll capture as many of them as we can to address at the end of the webinar. And if you are here with us listening to this and registered, you will be receiving a copy of the recording after we're done with the session. And now, without further ado, I would love to have our panelists introduce themselves. Why don't we get started with Courtney, please?
Hello, everyone. I'm Courtney. I am the supply chain and workforce manager at Meru Health. My role is all about building the behind-the-scenes systems at Meru that provide support and enable our clinical teams to deliver compassionate care when people need it most. That's really what Meru Health is, a comprehensive 12-week program combining licensed therapist support and mindfulness practices to treat the whole person. I'm excited to join today's conversation on compliance and look forward to sharing insights from my own experience and engaging in this discussion with all of you.
Fabulous. And Wade?
I'm Wade. I'm the director of product at Wingspan. And Wingspan is the best payroll platform for contingent workforces. We work with a lot of telehealth and behavioral health companies. And so I'm excited about all of the nerdy aspects of compliance, how you verify identity, how you make sure the right people are providing your services, and any kind of gotchas along the way.
Awesome. Thanks so much. And of course, this wouldn't be a compliance webinar if we didn't have some hardcore Zoom webinar compliance to ensure the video is working properly. Hello, everyone. I'm Solome Tibabu, founder of Behavioral Health Tech, and we are the largest community focused on expanding access to mental health, addiction, IDD services, and more. And of course, with that, many provider organizations in our ecosystems will relate a lot to the conversation we're having today. So super excited to have both of these amazing experts with us to share their real world experience. Okay, now to dive right in, maybe I'll ask both of you this question. How about Courtney and then Wade? Just to set the foundation, can you talk a little bit about what has changed in what you've seen change in behavioral health over the last few years that especially makes 1099 compliance and fraud risk really set a big issue right now?
Yes, that's a great question. I'll go ahead and start us off. I think one of the important things that we've seen over the last few years is just such a boom in this telehealth expansion. And so, especially following the pandemic, we've seen so many more visits that are telehealth rather than in person, which has created this new environment that's come with multi-state clinician networks and organizations that are rapidly growing and need to keep up with those compliance standards. So this new environment has definitely created more complexity on the clinician network side. It's growing at bigger speeds than before. And this large scale definitely opens up possibilities for more compliance gaps or different improper models, having most providers as 1099s. So just the convergence of these different factors has really created an unprecedented compliance environment that's rapidly evolving for companies to keep up with.
Yeah, a few things I would add to that. I think, as Courtney mentioned, COVID was a big driver first of this kind of healthcare moving digital. The operating model is changing much faster than the controls. I think second, on the enforcement side, it's scaling up a lot and becoming a lot more data driven. In June of 2025, the Department of Justice charged over 300 defendants tied to over $14 billion in alleged fraud, with telemedicine and behavioral cases called out explicitly. So the DOJ is now openly using a lot of data analytics, multi-agency data sharing, which means that sloppy controls will surface in these sweeps, the same as bad actors. And then third, a lot of headline cases have hit the behavioral space directly. Dun Global was charged in a $100 million Adderall scheme, and I think that there was a sentencing yesterday for that. Minnesota recently unsealed a $15 million neurofeedback fraud indictment, on and on. And I think a few other challenges. Fourth, like the policy environment is shifting a lot. The DEA and the HHS, although they've extended the substance control flexibilities through December 2025, that may change. And then finally, I think behavioral health has become a lot more visible and more capitalized in the market. I think speaking from personal experience, much greater number of my friends are seeking healthcare online. And so it's just much more in the public eye. When something goes wrong, it ends up in press releases faster. Moving virtual, moving to contractor heavy models, enforcement and tax rules tightening. So that all means that it's becoming super important to think about this year round, not just when providers are onboarding or during tax prep in January.
Wow, those are some astounding examples, and they happen every day. There's, yeah, I love how you said that, Wade. It's like so much innovation was unlocked with telehealth and AI now, but of course, just even keeping up with all the many ways things can go wrong and massively costly, visible, impacting real people, on and on. And even just for you both, like Courtney, if I could ask you, based on your experience and what you've heard from other leaders in the space, maybe more personally for you, scaling telehealth and hybrid networks, can you talk a little bit about what keeps them up at night, yourself as well, in the 1099 world?
Yeah, I know definitely one of the biggest things is just losing control of compliance as companies grow. I think that's one of the biggest things that keeps me up at night. One of these examples would be with the growing clinical network and bringing people on as 10, there's always that risk of misclassification. And that's a big issue for compliance. So we've actually seen that here at Meru. When we were a smaller company, all of our providers initially were on as full-time employees. But then as we grew and scaled the company to make it across multi-states, we did transition our providers over to the 1099 contractors. So I think keeping that model and making sure you have the control over that clinical quality, but not too much control, is definitely a challenge. So I think those are two big challenges. And then finally, I think this environment has evolved so much in the last few years. And so just moving into this unknown future is also always a big challenge. And so it's unsure what you don't know. And so I think moving into the future, this compliance and regulations, we're not quite sure that things are ever evolving. And so just how can you prep that network and stay ahead of these regulations to keep your company scaling and growing?
Thanks, Courtney. Yes, I think a lot of startups in our audience can relate to that. Just even seeing that journey with Meru, super helpful. And Wade, going back to something you said earlier, even with all of the headlines, it seems like a lot of organizations still feel like we're doing the basics. We've got our policies on paper. We're probably fine. But just maybe based on the cases you've seen, can you talk a little bit about what are the blind spots that many of these traditional policies are missing?
Yeah, that's a great question. I think often when I hear we have the policies, I think they usually mean we have some handbook that's been sitting in a document in some folder that's has cobwebs on it that no one has really seen in years. But I think real risk hides where those policies disconnect from the daily systems. So I see a couple of blind spots where this tends to happen. I think first, you can't really treat identity as a one-time event when providers are providing services remotely. Most organizations tend to verify identity only at onboarding. For example, in 2024, an unlicensed woman at Brightside Health allegedly used her wife's login to counsel hundreds of patients for 2 years before she passed away. So that policy might say licensed clinicians only, but if your system can't verify is the person who signed up the same person who's in whatever session, is the same person who's receiving the patient or the payment, that's a big challenge. I think second, there's offboarding and life cycle risk. The manual might say you need to revoke access when someone leaves, but it's really automated. The DOJ recently charged a Texas clinic owner with billing Medicare $4 million for under resigned or even dead therapists. In a 1099 model, if you're not offboarding effectively, that's where this quiet risk accumulates. Third, I think equating notes with compliance. The HHS OIG found Indiana made 56 million in improper payments due to missing documentation elements. So traditional policies might say, okay, you need to document everything, but they lack the automated logic to validate that the documentation actually justifies the billing code before the claim goes out. And then just two more. I think people tend to treat taxes as an annual administrative, but the IRS has recently lowered the e-filing thresholds for tenant demands action on incorrect tax IDs. So you need to be doing tax ID matching at onboarding. You need to make sure you automate the notices. Otherwise, you have an obligation to withhold 24% of contractors' income. The last thing I'd add is just like a lot of companies I see are like, okay, this is an IT problem, but it's really the fundamental to the business model, the provider experience. Confidant Health, for example, recently exposed over 120,000 files because no one verified vendor storage protocols. Although like policies are great to describe the right intent, but if they stop at the PDF, they're basically just blind spots. So those are the key kind of issues I've seen among many more.
Wow. I hope our audience is taking notes here. There's just a multitude of things to keep up on. And I'll put myself in the shoes of a new provider. Let's say I'm running a multi-state behavioral health network that really relies heavily on 1099 clinicians. And I'm looking to evaluate technology partners. Maybe I could hear from both of you, Courtney and then Wade. What are some of the things that I should be looking out for to protect my organization from compliance risk and fraud and some of these many examples?
That's another great question. And it's something really applicable to the work I've done, just evaluating things and making sure that Maker stays compliant. So I definitely think one of the important things would be just to make sure that there are these contractor safe workflows that would really help in this 1099 misclassification concern. And so this would be making sure that there are tools that can guide our providers and set them up for success and the quality care mandated employee-like control, but we give them just the templates that they need and the tools perform. I think another thing that's really important that we've seen here is different automated and monitoring tools. So I think definitely with our onboarding process, one of the things that's been really important is just using platforms that can do the primary source verification for you. It really speeds up and streamlines that onboarding process. And as you're looking to grow, the turnaround time for bringing providers on can really be shortened. And I think that's been really important as companies grow, and something that we've definitely seen here as we try and bring on providers. Holdups can be like background checks and things like that can be slow and timely. And when you're ready for a provider and you want to start having them trained so they can start seeing patients, I think automating this verification process is really important. So along with that, kind of just monitoring as well for different licenses, just any expiration tracking, the different state to state requirements, CE trainings and things like that. Those are definitely important as well. And so I think things that have those embedded have been very beneficial for us. When we started with a smaller provider 1099 network, we definitely had providers cross-license in as many states as we could get them. But that opened up a lot of opportunity for these risks, gaps. We're just growing exponentially in the number of states cross-licensed. Having these checks and monitoring, I think, is definitely very important. And then finally, I think just like these integrations and automations that you can put things really just that compliance is built, you're not worried about these blind spots Wade was alluding to. Just having those performed for you, I think is very important as we seek out technology partners.
Sweet. Yeah, I'll just add a few things to that, Courtney, which is this is the checklist I give to leaders to vet their vendors. Your partner or your set of partners should be able to show these things in details. First, I think you need identity verification you can stand behind. So you should ask them, show me exactly how you prove who a clinician is. You'll want to see remote ID capture and selfie matching at onboarding. But even today, AI is more able to impersonate people in videos. So you need to ensure that there are built-in guardrails for that kind of impersonation. More importantly, you really need device binding. So if a login comes from a new device or a new country, the system shouldn't trust it. It needs to escalate. That's the main thing that's protecting you from an unlicensed actor using a valid therapist's login. Continuous primary source licensing, exclusion screening. Do they screen against OIG and state lists every month? What happens when there's a hit? It shouldn't just send you an email. Ideally, it needs to integrate with your payments platform, stop scheduling, and freeze payouts. Payment integrity. A serious partner needs a rules engine that understands like impossible time. If a provider is meeting 1,000 patients in a day, probably not right. The system should flag it. So you need automated logic for those high risk payments. Directory hygiene. As I mentioned before, regulators are cracking down on ghost networks. You need accurate rosters that don't rely on manual updates. 6, you need a year-round tax workflow. Like I mentioned before, if your answer to tax compliance is we'll send you a CSV in January, that's just not good enough anymore. You need digital real-time TIN matching the moment a clinician joins, and you need logic that triggers that 24% backup withholding when the IRS requires it. Last but not least, you need audit trails and security. If a regulator knocks on your door and you export a complete dossier for a single provider, something that holds their identity, license history, exclusion results, and for security, you need specific protocols on how you store session recordings. You do not want to be the next data breach headline. Finally, I think there's this overall system architecture question because often companies pull together a lot of different tools to build this workflow. How do you bind identity, credentials, and payments all together? Most organizations keep those in silos. HR has one list, credentialing has another, AP has another. I think we'll see more integration across these systems moving forward to reduce the risk of impersonation. So those are the main things that I recommend folks look for.
Thank you both. These examples are just amazing, and I would love to continue on. As a quick reminder to our audience, please feel free to drop your questions in the Q&A box below. But going back to this topic, not that I have any intention to launch my own provider organization anytime soon, but I love the examples, and perhaps you can share just a little bit more about what each of you have seen in maybe your own organizations around designing compliance processes and adopting tech so that protects your companies from not coming to a grinding halt in operations. Maybe Wade also.
Sure. Yeah. This is a really common concern I hear. Usually sounds if we turn all of this compliance infrastructure on, are my clinicians going to revolt? And ultimately, will that mean that I can't grow as quickly? And I think there are a few common recommendations I give. Like any user experience challenge, there's some tension here. But I personally think strong controls can coexist with a good provider experience, but only if you treat compliance like a product problem, not a policy problem. So a few patterns that I've seen work effectively and consistently. One is to put that heavy lift moment at the moments that providers already expect friction. So clinicians expect a little friction at onboarding or when they change something important. They really don't expect it 5 minutes before a session. So front load these checks, do deeper identity verification during the onboarding process with a clear progress bar, pull licenses automatically at onboarding, then recheck in the background and only interrupt when something actually changes. The second piece is, again, we talked about like information being distributed across a lot of different systems. That is a challenge for providers. And it's much better to reuse data you have instead of asking the same questions repeatedly. So a lot of frustration we hear is you're making me type the same thing over and over. Good systems reuse those facts across workflows. So the legal name and verified ID and W-9 should feed directly into your 1099 process, should auto-populate any documents that need to be signed. The third is to design controls as guardrails and less as obstacles. So instead of having a separate compliance portal, I'd suggest building the controls into the tools they already use. So when a service type and location is picked, the system should quietly check licensure. Only if something is off should you send a message. A few other things. The fourth is you should show the benefit of this stuff to providers, not just the risk to your organization. For example, instead of saying, we need to see your license details to satisfy regulators, speak in terms of, if your licenses and tax info are complete, you get paid faster with fewer holds. The last product perspective is just to test things with real clinicians and iterate. Like, this process will get better as you evolve it over time. From a Wingspan perspective, this is something we think about a lot because we try to bundle identity and tax collection into one integrated intake that is connected to the rest of your tools. We like to treat clinicians as users of a high quality product, not like subjects of a policy.
Wonderful.
Yeah, those are the main tips on my end.
Yeah, I'll go ahead and piggyback off of that. Definitely similar things that we see here at our company. And I think one of the points I really liked that you made, Wade, was show providers that this compliance is be good for them and improve their portion of the job. It's not just for us as a company needing this, but it will improve their day-to-day. Example of that is definitely like the onboarding process is a great place that you can make a lot of those things happen that become then just things that are routine and happen in the background, needed every now and then from providers. And I think that's definitely very beneficial. I think something else that we've seen here that's helpful as well is just making sure that we have these different platforms and kind of one single source of truth with things embedded for our providers to use. And so this, just having that one area for everything really decreases room for errors and it allows that accountability to increase. So as the network grows, it's definitely making sure that those teams are connected and that people aren't really working in silos anymore. I think lastly, the thing I would add is just we've seen a lot of great pre-built automated workflows that help us reduce this risk. And so some of those are just allowing you to put compliance on autopilot when we are able to internally build something that flags different things for licensing or credentialing, helps improve how our clinicians are able to work across state lines without a problem that we are creating for later. So I definitely think, yes, using just different alerts and things like that and automation really improves our overall workflow and reduces that compliance risk.
What I'm taking from this is both of you touched on how important that change management process and the communication to your partners and providers is just as much important. So really wonderful to hear those examples as well. Now, pivoting to the future a little bit more, maybe Courtney, I'll start with you this time, but also Wade, just looking ahead a couple years from now, how do you see this space evolving, including compliance around telehealth, multi-state work, 1099 contractors, all of the things?
Yeah, I'll go ahead and start us off with this one. So definitely, I think one of the things that we are moving towards is just tighter oversight. I think we're already starting to see that. I know Wade went over a lot of things earlier in our discussion, but I think just understanding that we need to create these compliance tools and real monitoring now so that we can keep up with regulations. I think along that note, I think just creating flexible networks and being prepared for some instability is also very important. That there's, changes are happening all the time. They're happening state by state. We have these systems that can adapt quickly. Those are the type of organizations that will thrive. It doesn't necessarily mean you have to have the perfect compliance set up today, but just being ready to adapt your system for what's coming, I think is going to be really important as we move forward. I think another important thing across the multi-state licensing, I have hoped that this will be simplified, that certain licensure requirements and things like that, as we really move to this telehealth environment. We're already seeing that some places with the compact, allowing licenses being recognized through multi-states and just different reciprocity. But I think might be something that we can see improve, make it easier for this, as so many people are wanting this flexible telehealth 1099 structure. And so I think that's something to look forward to. I think even with that, documentation will still be critical. So still keeping these enforcements and documentation of what's needed is very important. And then finally, as everything is growing and technology continues to improve, we definitely have room for more sophisticated compliance or fraud prevention systems. And so I think keeping up with just the different AI tools is always a bit of a double-edged sword that can go both ways. But I think there'll definitely be ways that we can use those to help prevent any potential fraud risks. So I think definitely technology continues to play a big role and will continue to just be an important part of these networks.
Yeah, a lot of my thoughts are aligned with what Courtney said. I think the next 3 years will feel like this. Basically, the flexibility of the remote model stays, but the margins for sloppiness disappear. There are a few big shifts, I think, that are a part of that. One is that telehealth is becoming permanent, but conditional. The era of the COVID emergency flexibility is ending, but telehealth isn't going away. It's shifting from anything goes because we're all living in our little apartments and not putting pants on in the morning to prove you followed the rules. So you need system logic for every visit. Where's the patient? Where's the clinician, et cetera. I think we're seeing more and more algorithmic auditing by the DOJ. It's not going to be humans always regulating you. It might be AI as well. So things like roster inaccuracies or impossible days, they'll be immediately statistically flagged. But I think on the other side, like you have agentic AI emerging where you'll be able to tell an agent, hey, read all of the changes in the Washington State My Health, My Data Act and look through all of our policies and figure out what needs to update in terms of our policies and processes. I think the last shift is like the 1099 world is becoming polarized. There are shifting tax thresholds, and the Department of Labor is moving back to a broader totality test for employment status. For large networks, I think they need to ask questions like, can you prove with data that your relationship with these providers is truly business to business? Is there the invoice? Are they operating as an S Corp or an LLC? And those are also things we thought about when building Wingspan as well.
Just great advice across the board. And I can see a handful of questions are already rolling in from our audience. But if I could just ask you both one last question. If you had to leave leaders with just like one or two concrete actions that they can take in the next 90 days, where do folks start? Regardless of the tools that they use, what would maybe those one or two things be? How about Courtney and then Wade, please?
Yeah, that's a great question. I definitely think it's things that companies should be thinking about and not just pushing compliance issues down the line. My advice, my two concrete actions, I think first would just be to audit your 1099 network and really look at it with a compliance lens. So identify if there's any gaps. I know we've discussed a lot of areas for that, but look into your licensing workflows, look into your credentialing workflows, look into anything that might open you up for the 1099 network misclassification, any signs of employee-like control or anything like that. And then definitely document those. And so just taking a view of these compliance risks and documenting them, coming up with corrective steps. And so I think even just a small internal audit like that can definitely help prevent major regulatory or compliance headaches. Step one would be to just audit your current network and look at it and see if you can find compliance issues. Standardize and automate any high-risk compliance processes. So some of these things can be built into your existing workflows so that they run automatically. And there aren't any extra or manual steps, but they can keep you ready and prepared and know that you're not missing any blind spots or things like that. So even just a simple dashboard or automated reminders can really make a huge difference. And these are ways that you can reduce that risk without operations, is by having these different standardizations and automations. So those would be my two takeaways for anyone right now. Is audit your 1099 network and kind of identify those gaps, standardize and automate these processes. And I think that will really set you up for success.
I think my thoughts are very similar to Courtney. I think I would add, I might even think about these as two fun games or exercises. They're not really games, it's compliance. So try to make it as entertaining as possible. The first game I'd play is to pick a few clinicians who represent your real risk profile, multi-state providers, high volume billers, or those in high risk lines of business, and try to put together a complete dossier on them right now. What's their identity? How do we know this person is who we think it is? What licenses do they have? What is the evidence of those licenses in each state? Are there any exclusions? What's their income? Connect their tax ID to the payments and the specific billing codes. I think usually when I go through these exercises with teams, we discover a few things. One is like the data is scattered across spreadsheets and disparate systems. Two is that although in this exercise you're playing with a couple contractors, these gaps would be very uncomfortable to deal with in an audit when you're dealing with much higher volume. And three, it takes much longer than you'd expect to answer these simple questions. I think that kind of gives leaders a good sense of where these challenges might emerge in an audit. And then I think moving from like understanding the problem to, okay, how can we start assigning responsibility and fixing it? I like to build a living compliance blueprint. So get your executive and leadership team in a room and write a 2-page document, not a 1,000-page document that answers 5 questions at a board level. How do providers enter? Who decides if they're a contractor? What checks are mandatory? How do they practice? How do we map telehealth rules into our scheduling logic? How do they get paid? What has to be true at the moment of payment for that money to move? How do we report? What is our strategy for the new 1099 thresholds and the 2026 SUD privacy rules? And then lastly, how do we prove it? If an auditor asks for this clean data on 20 clinicians tomorrow, could we produce it and how? Once you have that blueprint, assign owners, pick your metrics. And generally at Wingspan, this is where we tend to plug in. We act as the system of record for the entire identity to payment chain. Whether you work with us or not, I think these 2 moves will put you in a completely different place a year from now, because I think they force you to see compliance not just as a stack of policies, but like a living and breathing system you can measure and improve, just like, the quality of your product.
Well, Wade, you both definitely made compliance way more fun and interesting today. So I thank you for that. And from your wealth of experience, I know your team sees this sort of thing every day, all day at Wingspan. So I definitely encourage our audience to go learn more. Which, speaking of our audience, maybe we can ask a few questions that have come in. Let's see. I'll start with someone's asking, how do you make sure documentation actually justifies or matches the code build? Do you have compliance tools you use or any you recommend? Maybe Courtney?
Yeah, I can start and take a first stab at that one. I think that's a great question. And here at Meru, a lot of our compliance tools are actually internally built. We have a lot of things. And I think for this example with documentation code matching, I think one of the things that we rely heavily on here is just those standardized templates that we can give providers and help guide what is needed in the documentation for these different elements of the CPT code. So depending on what type of session or call it is, we have different templates that go alongside those and prompt the providers to write down the medical necessity or different things like that are needed for the billing. And so along with this, I think another thing that's really important along with the documentation is just having review of that documentation to make sure that things are being submitted properly. Having a peer review going over this documentation is also very important. And this is where things can be flagged if it's something that looks like this may not match the CPT code and can catch that before it's being billed. And finally, making sure we continue to train and provide all the tools and guidance that our clinicians need is very important. So I think those are things that definitely help us make sure we have the right documentation that's needed.
Lovely. Let's see. I've got another one here. Okay. Someone wrote a quote down that I think Wade said earlier. Strong controls can coexist with a good provider experience, but only if you treat compliance like a product, not a problem. I remember you said that earlier, Wade. Can you talk a little bit more about that piece and how you view compliance as a product?
Yes, but I'll caveat it with I'm a product person. So when I get into a conflict with my partner, I pull my Post-it sticky notes out and Sharpies. So this may not apply to everyone, but the way I think about it is first, I think you really need to understand your providers or your users. So what's important to them? They want to get paid quickly. What are they anxious about? develop a really clear understanding of who these people are such that you can design the experience to meet their needs. Second, you have to treat the provider experience and the controls as a continuous process. It's not something that you'll just ship once and never change. It's something you should constantly be iterating on as you learn, as you grow. And then the question becomes, okay, how do you get the insights required to make that provider experience better? First, I recommend go through the onboarding flow yourself, put on the provider hat, and see what the experience is like. Second, create forms to collect feedback from providers and use those to inform the experience. You'll very quickly learn where the friction points are. And then lastly, pick a technology partner that can help you with this and can help unify these disparate systems and allow you to both be compliant, but also to grow your provider base and ultimately grow your business.
I think that's great, Wade. And I just want to jump in as well on this one. And I think you have it exactly right that compliance is definitely a product problem and not a policy problem. And we've definitely experienced that with our onboarding as well and our use of Wingspan. We've seen so much improvement in the process and are just the quick turnaround and the things like that has really helped streamline and grow our provider network. So we're really happy to see that as a way to improve these compliance and have a great product.
How do you create compliance processes that don't slow down clinical operations? So
I think I touched on it a little bit before in terms of putting moments of friction where providers already expect friction, reusing data, don't ask the same questions repeatedly, show the benefit to providers and test the flows with real clinicians and iterate. I think those are the key things to not allow compliance to impact the clinical operations.
I think one of the things that we've really noticed is that if you're just able to embed this compliance into an already existing workflow, I think that's been really beneficial for us. And so I think we've talked a lot about just onboarding and licensing and things like that. And so we've had these workflows exist, but making sure that they're compliance ready with different verification and documentation and just including it in that one workflow definitely also gains trust from our clinicians and provider network, making sure that we can get these things and stay compliant, but not slowing down our overall processes. So we're still able to accomplish what we've done. And then again, I think we've touched on this a bit, but also just making sure that we have that flexibility in there. I think that's really important and that we're adapting as things are changing and we're recognizing that and guiding our 1099 workers just in that where it's possible.
yeah, that's great to hear that there are some strategies to support with this. I'm walking away from this conversation. We don't want to mess around with this stuff. So let's take our time and do things right. And really grateful for the amazing examples and insights that both of you could offer today. Just for our audience, if you're excited to learn more, please reach out and learn more about Meru Health as well as Wingspan. Really appreciate your time, Wade and Courtney. Thanks so much.
Thank you.